All right, I think we'll go ahead and get started. Welcome and happy Wednesday. Welcome to the HFMA Colorado Chapter Summer Webinar Series. We want to take a moment to first recognize our annual business partners. Our business partners not only provide financial support to our chapter, but they also share their knowledge and expertise through speakers and presentations. Their support allows us to operate our chapter and bring our members quality education and resources. We hope that you will take a look at them first when your organization needs services or support. For today's webinar, we will be using the Q&A box located at the bottom right of your screen. We will be monitoring the Q&A panel during the presentation to answer questions along the way, as well as addressing remaining questions at the end of the presentation. A link to download the presentation will be provided in the chat box, as well as be sent via email at the conclusion of the webinar. Today's webinar, Engaging Patients and Addressing Financial Concerns from a Distance, is being provided by one of our platinum sponsors, PATIENTCO. So we welcome Heather George. Heather is the Chief Revenue Officer at PATIENTCO. She's helping health systems improve their revenue performance through improved patient engagement. Heather has over 20+ years of HIT experience supporting enterprise health systems. Welcome, Heather.
Thank you, Jessica. It is my pleasure to be here, and I'm excited about the opportunity. As we were talking earlier, I have a special place in my heart for Colorado HFMA. You guys have just been great partners to us, and we look forward to the discussion today. I wanted to start off with a giveaway, right? So who doesn't like a fun raffle and reward after a long day's work and participating in webinars? We are going to be doing a beer or wine basket. We'll be doing a drawing. So if you stay through the duration of the webinar, and we look forward to good questions and answer session as well, we'll be pulling this together and we'll notify you once we have a winner. So for our agenda today, I wanted to just kind of go through a few things we'll be covering. We'll do a brief introduction to give you some background on PATIENTCO. If you've not worked with PATIENTCO in the past or talked with us, we'll give you a high-level overview of what we do and the systems we serve. We'll talk about what compassionate financial care looks like, particularly in a post-COVID modern world, right? We'll talk about how health systems that we've worked with have addressed compassionate financial care and adjusting financial policies and ensuring that patients have what they need to build loyalty, for you as a health system to build your brand, and how to engage patients. And we'll talk about digital patient engagement, what it means, why it's important, why it's something that we should definitely consider, particularly as we've seen the COVID-19 pandemic sweep across the country, and telehealth and other options have risen in their usage as patients are looking for a more digital way to engage with their healthcare providers. So a little bit about PATIENTCO. PATIENTCO was founded over 10 years ago in Atlanta, and really it was from a desire to simplify the way patients interact financially with their healthcare providers. What started as a mission to make billing statements easier to read and patients given an option to pay has really grown into a full suite of products and services, and we are reducing the complication and friction that is found within the patient financial experience today. We recognize effective outcomes for healthcare can be improved, population health can be improved if patients don't delay their healthcare based on cost, and they also understand simplified processes, transparency in what they're going to be charged. We believe all of these things to be paramount paramount to really changing healthcare. We have over 3,000 active healthcare locations and 21 million unique patients that interact with the platform every day. We process over $1 billion annually, and we're really proud to have most recently received the HFMA peer review designation, which many of you probably know is a very thorough process where HFMA evaluates the ROI, the patient satisfaction, or the provider satisfaction, and all of these things come together to represent that HFMA peer review designation. So as we talk about compassionate financial care, and we talk about the concept of helping patients understand what they owe, why they owe, all of these things, how do we accomplish that in a socially distant world? I think we're all very used to interacting, our revenue cycle teams interacting, we coach them, we help them understand how to offer compassionate care to the patient after service. But what can we do, and what does that look like holistically as we think about compassionate patient financial care? Let's start with what we define, how we define compassionate financial care. The crux of it is really around how do we equip patients with the information and payment options that they have available that make it easy for them to self-navigate their healthcare financial experience? How can we equip them to have a consumer experience very similar to what they're used to having through Netflix or Amazon or any number of ways that we've seen digital platforms rise? The components of those things, when you break it down, really benefit not just the patient, but also the health system. When we think about what we need to do from a technology perspective to facilitate compassionate financial care, we really look at two different things. What do patients want and what do health systems need? And how the two can be brought together to provide a superior experience for every user, whether it's a revenue cycle team or the patient. So patients, what do they want? They want easy to understand financial communications and in language that they understand. They want to receive those communications through their preferred channel, whether it's a stated need, like they state they want to receive a text message, but also an implied need. If they don't respond to that text message, how do you engage them at the next level? They want self-management of payment plans. They want to be able to self-enroll. They want to find an option that works for them. And they don't necessarily want to have to call in and admit that they can't afford a healthcare bill they've received. Patients want to see a historical view of their statements, their payments, whether it's for reporting purposes or even just to understand how their whole financial liability is coming together. They want to have a historical, comprehensive view. But what do health systems need, and how can health systems provide these things to patients? Health systems, we found, you really want technology that integrates seamlessly with your EMR, your HIS system, and your revenue cycle system, patient accounting system. You would like digital alternatives to paper-based communications so that you can drive down costs and wring out some of the inefficiencies that are out there around paper-based communications. You also want to have a way to digitally deal with received paper-based communications, whether that's a mailed check or a correspondence that the patient sends in. You'll want to make that digital so that you can support a remote team in this current environment. You also want billing communication to go out with clear payment options, which will drive payment and accelerate payment from the patient while driving down AR days. And you want tailored payment options for patients based on how likely they are to pay, how likely they are to engage, and what you want to be able to offer out. Post-COVID-19, or even really during COVID-19 now, we have to make adjustments to meet the patients where they're at. What we've seen as the coronavirus pandemic raged across the country and hit in various pockets, we've seen that compassionate patient financial care and the need to engage digitally has gone up significantly. In fact, PatientCo did a national survey with over 2,000 patients and more than 50 large healthcare organizations. And we launched the survey in early April. It's actually available now if you want to go check it out on our website. We found that early in the pandemic, as soon as early April, over 23% of patients were financially impacted by the pandemic and the ensuing economic challenges we've seen. That number has certainly gone up over the past several months, but it was really interesting to see how quickly the pandemic and the economic fallout hit. We also, as I referenced earlier, saw a 50% surge in telehealth visits during March based on the pandemic and patients not wanting to go to a hospital for fear of the disease. So I want to take a minute to do a quick poll and understand, given the economic impact of the organization, how is your organization looking for technology or ways to offer more compassionate financial care? I'll just give this a minute so everybody can weigh in. You always love the poll silence where we're waiting for response. How are we doing, Jessica?
It's looking good. It looks like we've gotten 17 out of 26 responses, and we've got about 65% at yes.
Wow, that's great.
At no, and 12% at not sure.
That's great. Well, let's talk about some other ways that we've seen clients, at least within our portfolio of customers. Let's talk about what they've seen and what they've been doing to offer a more compassionate financial care and a compassionate financial experience. One of those things is adjusting financial policies. So we've seen best practices where health systems, revenue cycle leaders, chief financial officers, et cetera, are all stacking hands and deciding, okay, what can we do to adjust our financial policies to make things easier for patients? The number one thing that they're doing across the board is trying to remove financial barriers to care, whether that is pausing payment requirements for 90 days, whether it's making payment plans available at time of service, or enacting pre-registration requirements to inform patients of financial options. We've seen a large increase in organizations who are offering digital communication, they're leveraging their portals, and they're talking through different ways that they can support the patient digitally prior to service, at time of service, and even post-service. As part of fine-tuning those financial policies, we really study the data at PatientCo. We're a data-driven organization. And what we've seen is that prior to COVID-19 hitting, the pay in full rate and the balance on anything below $350 is actually somewhat high. But as balances grew above $500 prior to COVID, partial payment rates exceeded the pay in full rates, which tells us that patients are really looking for affordable payment plans and payment options. It's also telling you they want to pay their bill. They just can't pay it in total. So after coronavirus, what we saw is that 23% of patients, I referenced this earlier, had lost their job or had reduced hours since the pandemic was declared on March 13th. This was based on early April results. And what we've subsequently seen after this is that in a post-pandemic expectation, the economic impact will put patients in a place where they have much lower balances that they cannot pay in full. So that means you need to adjust your financial policies. You need to think about when you're offering self-service options, payment plans, all of these types of things. We've also seen that patients want to log in and get self-service payment plans. They want to sign up online. They don't want to have to call. And we've seen an increase in both the dollar amount that patients will commit to, as well as the number of payment count types. When you compare that to provider-initiated payment plans and counts, it's a much lower dollar amount and it's fewer payment plans that you're actually getting. Why make this shift? What does it do? It helps your team be more scalable. It helps your team in a remote work environment be more compliant. You also improve the patient experience, and overall you see more revenue coming into your organization with better outcomes. So we say all of this to say that the flexible financial policies are one way that you can address change. You can address all of the financial needs that are coming at you, all of the different patient types, whether you've seen a shift in your payer mix and the patient liability is now stronger, or patients have lost their work, their job, and they're in a difficult position all around. You want to allow patients to add new balances to those payment plans, set them up digitally. You can leverage third-party options when payment plans aren't enough. We have clients who utilize third-party financing options, and several are actually embedded into PatientCo, and so they're presented to the patient at the time they receive their bill. You also will want to use propensity to pay scoring to identify when patients' financial needs have changed, and tweak language on your statements or communications to direct patients to the financing options they have available and help them understand that they can control their own financial destiny in a situation where they may not be able to pay the balance in full. So let's do another poll. How has your organization adjusted, or has your organization at all decided to adjust your financial policies to make things more flexible during this time? We'll give everybody a minute to respond. Let's see. How are things going, Jessica?
Here we go.
Wow, that's great. A large percentage of folks, y'all are adjusting to your patients. That is a wonderful way to start compassionate financial care. So the next component, and something else you can do to encourage digital engagement from patients beyond telehealth, I think we can all agree telehealth is here to stay. A lot of patients, that's become their preferred way of interacting with their provider. There are digital tools that are available where you can engage patients and build loyalty to your health system. Compassionate financial care in a socially distant world has these three components. It's digital, it's convenient tools that meet patients where they are, it's personalized with tailored outreach based on data and propensity to pay scoring, and all of these things that help you personalize the communication so that unique financial needs of each patient are taken into account. And it's affordable. You offer flexible payment options. You help patients afford the cost of their care so that they're not prevented from going in and utilizing services. But what's interesting is that these things were all true even pre-pandemic. Patients have preferred digital for several years. In fact, PatientCo has done several national surveys like the one I referenced earlier every year for several years, and the results are pretty consistent, COVID or not COVID. Digital channels are always preferred over unexpected phone calls. You could see unexpected phone calls, outbound calls to a patient are the least preferred method of communication. But instead, they'd like to have the option for real-time chat, for receiving an email or e-bill. They would like text notifications or even secure messaging via a patient portal. The benefits for a patient really are they receive communications faster, showing their willingness to pay, their willingness to engage with you in a digital world and pay their bills. Also gives them access to self-service, flexible payment options where they don't have to call and admit they can't afford a bill. There's no shame in signing on to a payment plan that's available online. And they can interact with a message or with your organization regardless of their physical location. The benefits to this are huge, especially as you look to your organization and the efficiencies you can gain within your revenue cycle teams. You see that patients engaging digitally really does lift a lot of burden off your team. And the value of that is that you can anticipate and respond to your patients more quickly. You can have an increased volume of inquiries that you can respond to in a shorter time. And you can support contactless experiences, especially considering where we are with the pandemic and why you would want to have your teams working remotely, working from home, but still providing superior patient care and patient financial care within your teams. The other component is that you can use digital tools. You can use in-app messaging for one of the clients, one of PATIENTCO'S clients. We used our in-app messaging functionality to mass blast out information relative to how they can reschedule appointments, what kind of the procedures would be for checking in, and how they could use the solution to do all of those things when they did arrive at a facility or at the hospital. You can also do digital enrollment and handle a lot of those things. And keeping in mind that 32% of patients have postponed or rescheduled care because of coronavirus, these digital tools are really important to help your team, whether it's patient access or other, get patients back into the facility, get them engaged, get them moving through the system so that you are taking care of their health needs independent of the pandemic. So, as I said, there are things you can do to adopt your policies, adopting to modern post-COVID times, lessons learned from a health system a very large health system we work with, who is offering e-check-in for all of their locations. They are making operational changes to ER registration, and they're capturing consent electronically and verbally to engage in post-adjudication collection efforts and remain compliant with TCPA law. These are all things you can do and think through as you try to ensure that the patients have a strong experience, that the clinical care you offer and the financial care you offer match, and the patient remains loyal to your health system. Another tool that's in the tool belt, if you will, is you can offer different digital engagement strategies around pre-service or collecting telehealth visits. 60% of Americans say the pandemic has increased their willingness to try telehealth, and organizations still need to collect the copays and the different patient liability portion that they're owed as a result of that telehealth visit. We want to, again, keep shifting correspondence typically sent via mail to digital channels. I referenced the Patient Code digital mailroom earlier, where we handle and automate checks and paper mail received to allow people who are working from home to still review all of that mail. We also allow patients to submit charity care applications and documents via the portal instead of mail. Right now, in most healthcare organizations, patients have to submit their charity care application via fax or email or mail it in, and that certainly is not on par with some of the other digital tools that patients are used to using to submit different types of applications and different types of forms online. It's also important to look at your current check-in process. Can it be made digital, where patients submit documentation before their visit, whether it's an updated insurance card, whether it's a driver's license? Can they check in? All of these things, you can use digital channels to really engage patients and get them into the flow sooner in the process versus later, and get them comfortable to support the entire experience pre-service to post-adjudication bill. You can also see, I mentioned telehealth. You can consider how engaging patients via telehealth will help expand and drive your consumer focus on patients. And instead of sharing a credit card or interacting with a terminal, how can you use secure payment links via text message so that patients can submit their credit card information through a secure portal, in a PCI compliant way that reduces the risk of a patient transmitting a credit card back and forth or having to touch a terminal. All of these things are different strategies that you can deploy to help support digital engagement strategies for your health system. I mentioned the text to pay and the ability for patients to make contactless payments. Now that we are living through one of the largest global pandemics that we've ever seen, health systems have to see contactless payments as essential. We've talked to lots of clients and lots of organizations across the country, and they would like to use a solution that doesn't require a credit card terminal. Patients don't want a credit card terminal. So how do they still do that and remain, reduce their PCI scope and their reliance on hardware? We've turned the patient's smartphone into a payment device. So it enhances and streamlines data collection, improves the patient experience, fosters trust that you are taking these things into concern for the patient. And we've seen over 150% increase in contactless use since March of 2019. This is huge. Contactless payments were on the rise even before COVID-19, and they really are here to stay in this world. So I mentioned PATIENTCO'S text to pay. Here's a little excerpt. You prompt the patient on a tokenized link before submitting the payment information. It's much more secure than several other text-to-pay solutions that may be available on the market. We're never going to ask the patient to type in their credit card into a text message window or any kind of iMessage window. We're going to prompt the patient to be in a secure environment. The patient can also take a photo of their driver's license and health insurance and upload it for you to review it and make sure that everything is synced with your HIS system. All of this is easier on your employees. You don't have to manually enter payment information or scan a card, and everything complies with TCPA requirements. So one additional poll. What are you doing for digital engagement around a text-to-pay solution? You do have one, you're not using one. How does this impact you as you think about trying to bring patients back into the system? Give everybody just another minute here. How are we looking? Great. So it looks like a little over 1 in 4 have a text-to-pay solution, and other folks don't have it or interested to learn more about it. We would certainly welcome the opportunity to have the discussion. We'll get you some information later and discuss how we can support you in those things. But I think we'll just roll forward. I think I saw some questions come through. I don't know, Jessica, if you can see those, but in summary, this is really just intended to be a high-level overview of all of the different ways that you can support your patients, offer compassionate financial care, and how you can do that even in this world where we're all working from home and maintaining social distance. There are certainly technologies and tools you can use to support your patient experience, build trust, build brand loyalty to your health system, and make sure that you're protecting the revenue of the organization as we move through these next several months or years to come.
Thank you, Heather. Well, right now, it doesn't look like we have any questions in our Q&A box. If anybody has questions for Heather, we do have some time here. That Q&A box is at the bottom right hand of your screen. Feel free to open that up, pop a question in for us all, or if it's easier, you can also use your chat, also there at the bottom of your screen. We can, there we go. We have a couple questions here. Heather, it looks like our first question is from Sarah, and she asks, regarding the operational changes that health systems have made in response to COVID-19, are you seeing health systems make those changes permanent?
That is a really good question. We have seen some health systems change how they plan to work remotely or work from home on an ongoing basis. And we've heard that many of them believe that will be a permanent situation. It will be challenging now that they've got employees who are engaged and working remotely and being productive. They've seen where they believe that it will be very difficult to try to get people to come back into an office. So they're evaluating, this has a couple of implications. They're looking for tools that they can use to help manage performance. They are leaning heavily on patient code tools with reporting. We have a virtual leaderboard where you can have some fun, friendly competition, if you will, amongst the team, and you can remotely see what collection efforts are happening. They're also looking at ways to shed themselves of their office space. That's a big capital type expenditure that they're looking to adjust to conserve their funds. So some of those things, working from home, just like telehealth, here, I think it's pretty much here to stay. There will be some that will resume going back into the office where needed. But for the most part, if folks are able to work from home, we're seeing organizations tell us that they are looking to embrace that. The other, some minor things we've seen some health systems, particularly in Texas and some places that are being hit really hard right now, they had previously had financial policies where they were collecting a certain amount pre-service before the visit. They've paused those pre-service collection activities again around the whole access to care. They want to remove the barriers and make a patient more inclined to come in, but still having a very friendly experience after the visit. We've seen some of those policies kind of freeze along with the 90-day hold they've frozen. We don't anticipate those will be permanent. We anticipate those will come back online somewhere towards probably the end of the third quarter. But because the pandemic has hit folks in so many, it's very geographic. It's different all over the country. We have clients all over the country, and they're taking different approaches and tailoring their response so that they're appropriate to their patient populations given the time.
Thank you. One additional question, and this is, how often do you recommend looking at data to see if changes to your financial policies are needed?
Well, you know, you have the option to do that. I think right now it's one of those things where you really need to utilize a solution that almost does this for you. And for example, with PatientCo, we can monitor digital engagement at the patient level and see what abandonment rates look like. We can see how far the patient goes or patients go through the process to completing a payment. And when they kind of back off and send a message that the options you've given do not meet their needs. We can also take a look at propensity to pay scoring and see whether or not a patient needs to be offered a prompt pay discount up front, if they need to be offered a long-term financing option up front, whether they need a 3, 6, 9 month financing option rolled out, what we would consider a shorter term. All of those things are things that the PatientCo solution does for you automatically by studying what's going on at the data layer. If you're doing it on an ad hoc basis, right now you can look on a weekly basis, really on a monthly basis, depending on transition and your mix and when patients or when you're hearing of maybe a layoff in your area by a major employer where you're accepting that insurance, you want to check and see what that looks like for your patients. But it really is, it gets to be kind of a beast to study it and say, okay, once a week or once a month or whatever it may be, I want to change it. You really want to use a tool that's going to be actively monitoring that. And you want to partner with an organization that can come to you as they study these findings, or you can even see them yourself in the reporting or in the platform. You can see where patients are starting to abandon payment plans, and you can then have the information you need to make a data-driven decision. And you can see that if you're only offering 3-month payment plan options, or you're only offering a 5% discount, say, for prompt pay, you may see where patients are getting engaged, they're logging in, but then they're not doing anything with it, and that tells you that you need to make a change. That tells you that for that particular patient segment with that type of score, whatever that may be, you're going to need to make some changes to your policies. I don't know if that answers the question, but that is certainly how we think about things here at PatientCo.
Thank you, Heather. It looks like that is all the questions we have for now.
Great. Well, thank you so much, Jessica. I thank you all for joining today. It's always fun to talk about these things. It's, you know, kind of embedded in the fiber of who I am, that I want to improve patients' experience across the board and encourage them to seek the health care that they need to improve our communities, the health of our communities, and certainly navigate through the pandemic. I wanted to show we have a 2020 patient and provider survey that's available, the state of the patient financial experience. Feel free to go onto our website, download that report. If you have any questions or want to take a deeper dive on any of the topics that we've discussed today, feel free to reach out to us on our website or from learn more at PATIENTCO.com. And certainly, as I said, I appreciate the opportunity to talk with you all today. Colorado HFMA, you've been a wonderful partner to us, and we're excited to continue the conversation. So please feel free to reach out. I hope you all stay healthy. I hope that your families are doing well during these times, and we look forward to talking again soon.
Thank you, Heather. We certainly appreciate your time and, you sharing your expertise with us. I want to let everyone know, again, the presentation is available for download. The link is in the chat box. And, as Heather said, I'm sure she's very happy to answer any additional questions you have. Feel free to reach out to PatientCo. We want to also thank them for being one of our platinum sponsors of our chapter. We couldn't do anything without them. And we would like to remind you about some of the upcoming events we have. Upcoming next is this CHFP exam prep course. Unfortunately, this one is all full, but keep your eyes on this space because we are planning an additional prep course. These are taught by Dr. Jeff Helton, who's actually on the Certification Board of Examiners. They're really, really helpful prep courses. If you're thinking about getting certified, definitely keep your eyes open. We will be adding some new dates for that. After that, on July 22nd, we have our next webinar in our summer webinar series, Patient Interactions and Payment Trends Amidst the Pandemic. That's being presented by Nick Prola and Jerry Pierre with Professional Finance Company. So again, that concludes our webinar for today. Thank you all so much for sharing your lunch hour with us, and we hope to see you again really soon.
Thanks, Jessica. Thanks, everyone. Hope you have a great day.
Thanks.